Esophageal cancer doesn't get a lot of attention from the public, even though more than 16,000 cases were diagnosed in the U.S. last year. Unlike many cancers, esophageal cancer is usually an environmental disease, not a genetic one. To tell us more, Dr. Stephen Steinberg of Boca Raton Regional Hospital joins us with more. So explain to us the complications of this type of cancer.
Well, this is a cancer that develops typically from one of two causes. The most important one being smoking causes one of the two types of esophageal cancers. The other cause of esophageal cancer is something called Barrett's esophagus. And Barrett's is a change that occurs when people have been experiencing acid coming from the stomach up into the esophagus for a long period of time. It needs to be a good 5 years before that change will occur. And once that change occurs, it's not a cancer in and of itself, but it puts them at risk for getting a particular type of esophageal cancer, the one that's becoming more and more prevalent these days.
And what are the symptoms of esophageal cancer?
Unfortunately, in the early stages, there aren't any symptoms, and so it makes it difficult to diagnose, like many cancers. In the later stages, the symptoms largely revolve around the fact that the esophagus is responsible for getting food from the mouth into the stomach, and if there's a mass or if there's something growing there, then it inhibits the ability of the esophagus to do that, so people have trouble swallowing.
And how is it diagnosed?
It's diagnosed with endoscopy, which is the use of a lighted tube. I think people are familiar with the endoscopes we use for colonoscopy. We use a different one. We put it through the mouth and take a look at the esophagus directly. If we see something, we can take biopsies, and we can look under the microscope to see what, if anything, is going on there.
Can it be hereditary, or who's at risk for this?
It's not hereditary. It's not like breast cancer or colon cancer. It's much more related, as I mentioned, in the one case to smoking, and in the other to the long-term effects of acid on the lining of the esophagus.
Can heartburn be a symptom or something that triggers you to maybe go to the doctor and get checked out?
Well, heartburn's a good reason if it's persistent and if it doesn't respond to a number of drugs that are available. Maybe a good reason for getting an upper endoscopy, and that can help discover the Barrett's esophagus that you want to keep an eye on in order to prevent the subsequent development for cancer. Heartburn itself isn't a symptom typically of the cancer itself.
What are the treatment options?
Treatment options really, as with many cancers, depend on how early you find it. And so in the earliest stages, we can actually take many of them off with an endoscope as an outpatient and get cure rates that are as high as 95+%. Really pretty good if we catch it early. For those that are discovered later, we use chemotherapy, X-ray therapy associated with surgical resection, removal, and that gets us not such good results, but still we do get some cures, and so people ought to be making sure they get care for it.
All right, thank you so much for joining us. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.